Grateful to be here today. I also want to express my deepest gratitude to our witnesses, especially those who have hung through the entire hearing, a very lengthy hearing with so much to discuss. Madam Chair, I ask for unanimous consent to enter into the record a number of statements from Texas women, from providers, from nonprofits and organizations who will be impacted by this draconian law.
Without objection, and thank you for submitting them.
Thank you, Madam Chair. I represent El Paso, Texas, a community on the safe and secure, beautiful U.S.-Mexico border. And I want to say a couple things about the state that I live in and where we live in. In Texas, the very Republicans who have pushed this draconian piece of legislation have the audacity to call themselves pro-life. However, their actions don't connote any respect or reverence for life whatsoever. In Texas, we have an unacceptably high maternal morbidity rate. Absolutely unacceptable. And Republicans who've been in charge of the state legislature have been sitting on their hands as pregnant women continue to die. Texas children live in generational inequity and poverty because in Texas, the level of education a child gets depends on the zip code that they live in. And we live in a state that not only limits children's access to health care and their families' access to health care, but we live in a state that is trying to eliminate access to health care altogether through its lawsuits against the Affordable Care Act. We live in a state with a governor who prohibits mask mandates in Texas schools in order to protect the lives of Texas children. We live in a state that was essentially, with Republican leadership that was essentially silent as the prior administration separated children from their parents under some of the most heinous anti-immigrant policies that we've ever seen in our generation. We live in a state where Republicans oppose access to sex education and contraception in order to prevent unwanted pregnancy. Here in Congress, so the problem is not just Texas Republicans. Here in Congress, the same Republicans who support SB 8 and this draconian legislation unanimously and frequently and repeatedly oppose pro-child, pro-family legislation, such as the child tax credit, access to child care, access to housing, and a number of other Democratic-led policies that help enrich and save and create healthy families. They oppose these policies. This is not what I would call pro-life. We should not allow them to get away with calling themselves pro-life. Pro-birth, maybe, in some cases, but certainly not pro-life. Dr. Moyadi, we know that these draconian laws do not end abortion. In fact, we heard earlier, the first panel, we heard from my colleague, Congresswoman Barbara Lee, who talked about what she had to do in order to have access to a choice that she was forced to make, a very personal choice that she had to disclose here in front of all of Congress and in front of the American public. But she also talked about the way women, her peers, were dying because they could not have access to safe, legal abortions. Can you tell me, as Republicans seek to turn back the clock by decades on women and women's access to care, what will it do to women who will take their reproductive health care into their own hands?
Thank you for that question. I trained in El Paso for 4 years and my child was born there as well. So thankfully today, at least we have safe medications that people can access. Mifepristone and misoprostol can be safely taken and you don't need a physician to take them. And so the concern with laws that criminalize or legalize abortion today is not so much around the safety, because some people will be able to access safe medications, but around what happens to people that do access those medicines. We know already that Black and brown bodies are over-criminalized and over-policed in this country, and we know that people that seek those medications when they are illegal or not legally available are going to suffer the consequences through the criminal legal system. I do want to tell a story, though. About 2 years ago, 3, in our last legislative session in Texas, a bill was introduced that would make providing abortion care a felony and give the physician and the patient, the person seeking an abortion, the death penalty. Now, that bill didn't make it very far, but that very week that it was being discussed, a patient came and saw me and said, "Doc, I know that I'm going to get the death penalty for this, but I need this abortion." I provide this care, and I'm trusted by my neighbors to provide this care to them, and I do it out of a duty to care for my neighbors. But that really, as a mom, hit me very hard, that people know or might be confused about what the law is, but still want to come in for that care, no matter the consequences. And I think it's important to understand that abortion and birth, they're not separate. They are part of a continuum, and as long as people have had birth, they have had abortions, and we're not going to end them through laws.
Thank you both for your leadership. Madam Chair, I'm out of time. I yield back.
Your time has expired, and